get a picture, I have to get 1,000 words.
You actually want me to talk to the patient? Get a history?
We need to know if there's some genetic or environmental causes triggering an inflammatory response.
I thought everybody lied.
Truth begins in lies. Think about it.
That doesn't mean anything, does it?
12:52 p.m. Dr. House checks in. Please write that down. Do you have cable TV here somewhere? General Hospital starts in 8 minutes.
No TV, but we've got patients.
Can't you give out the asprin yourself? I'll do
I
paperwork.
made sure your first case was an interesting one.
Cough just won't go away. Runny nose looks a funny color.
Patient admitted complaining of back spasms.
I think I read about something like that in the New England
Patient
Journal
is
of Medicine.
orange.
The color?
No, the fruit.
You mean yellow? It's jaundice.
I mean orange.
Well, how orange? It's probably...
Exam room 1.
I was playing golf and my cleats got stuck. I mean, it hurt a little, but I kept playing. The next morning, I could barely stand up. Well, you're smiling, so I take it that means this isn't serious. What's that? What are you doing?
Painkillers.
Oh, for your leg.
No, because they're yummy. You want one? Make your back feel better. Unfortunately, you have a deeper problem. Your wife is having an affair.
What?
You're orange, you moron. It's one thing for you not to notice, but if your wife hasn't picked up on the fact that her husband has changed colors, she's just not paying attention. By the way, do you consume just a ridiculous amount of carrots and megadose vitamins? Carrots turn you yellow, the niacin turns you red. Find some figure paint and do the math. And get a good lawyer. Deep breath.
It's cold.
Has he been using his inhaler?
Not in the past few days. He's only 10. I worry about children taking such strong medicines so frequently.
What happened to your leg?
Your doctor probably was concerned about the strength of the medicine, too. She probably weighed that danger against the danger of not breathing. Oxygen is so important during those prepubescent years, don't you think? Okay, I'm going to assume that nobody's ever told you what asthma is, or if they have, you had other things on your mind. A stimulant triggers cells in your child's airways to release substances that inflame the air passages and cause them to contract. Mucus production increases, cell lining starts to shed. But the steroids stop the inflammation. More often this happens.
What? The more often this happens, what?
Forget it. If you don't trust steroids, you shouldn't trust doctors.
My mother passed away 4 years ago. She had a heart attack, and my father broke his back doing construction.
It's House. It's urgent. I'm sorry. You couldn't have knocked?
Steroids. Give her steroids. High doses of prednisone.
You're looking for support for a diagnosis of cerebral vasculitis.
Inflammation of blood vessels in the brain is awfully rare, especially for someone her age.
So is a tumor. Her SED rate is elevated.
Mildly.
That could mean anything or nothing.
Yeah, I know. I have no reason to think that it's vasculitis, except that it could be. If the blood vessels are inflamed, that's going to look exactly like what we saw in the MRI from Trenton County. The pressure's going to cause neurological symptoms.
You can't diagnose that without a biopsy.
Yes, we can.